I don't want to get in trouble. But sometimes, like, I'm gonna be honest, you have to have thick skin working in the vet field because I love all my veterinarians that I worked with, but they are very hard to work with. I've gotten yelled at. Oh yeah, I've gotten my ass chewed out. Sure have. I sure have. I remember those days. I was like, I remember going home crying because like the doctor was so mean to me. But you have to have like thick skin. When I was working in the ER department, I was like, this is like we had a dog that came in. It was hit by a car or GSW, and and it was on the right upper shoulder. It was superficial. The dog got loose. It was a pit bull, and I had doctors and technicians like running. And we finally got this dog, but we had to put a drain in it, and the dog was fine. But thank God it's superficial and it wasn't deep because that would not have been good. I also we had a snake that I had to monitor overnight. So I worked from 8 o'clock at night to 8 o'clock in the morning. So I had somebody that comes in, and it was a neurological snake. It was basically what it was doing was it was flipping on its back, and it was like having like a kind of a seizure, but something with the neurological problems. The doctor said, Gabby, just keep taking the heart rate and the respiratory rate, and just let me know. So like for a few hours, I told the doctor, I said, I think I'm concerned. I'm like, it's not looking so good. And then I'm like, I think you need to come in here and look at the snake. And she comes in and she's like, the snake's dying. And I said, what do you want to do? And that was really hard. And then we had a bird. It was a beautiful bird. It was white. It was gorgeous. Oh my God. The bird did not make it. And let me tell you, bird owners, I remember this to the day. I remember, I'm like, we called her and we're like, if you want to come, we can go into a room and we can discuss. And the doctor had to tell that the bird didn't make it. And she was hyperventilating and screaming and crying. And the bird was laying down in the cage with a blanket over it. She was like inside the cage, just bawling her eyes out. And then I had one client. She came in. She was, euthanizing her dog, and it was rough. I remember the screams, and I'm talking about screaming, like just screaming. Oh my God, it was horrible. It was horrible. I feel so bad. But like as technicians, we have to hold it together, and that's very hard because when you work in a GP practice, you're connected to a lot of the animals because they come regularly. So you're basically bonding with them, and you can't cry. You want to, and sometimes doctors and technicians will go in the back in the triage room and just cry. I've done it, and it's so hard because you have to bag them. That's the worst part of my job, where I had to bag them and put them in the freezer. That was hard. And then also what's really hard is I had to cut to send it to see if it had rabies, and that's what you have to do. It was dead, of course, but it was a cat, and we were learning, so everyone had a chance to cut. And then we had a puppy, and it died of parvo, and we had to cut the brain, kind of like examine like it was. Yes, I'm serious. That's what you do, and you send it to the lab to see if it has rabies. Yes. Wait, this seems to make you happy. Try really hard to go to school, for it will make you so happy. What? Was it 0.2? Crying is contagious to me. I will bawl with you. Yeah, but you can't really do that in the room. It makes us look unprofessional. Do you know how, it's not awkward, but do you know how, because like, okay, so when I was a vet tech, we had to like, sometimes it was the receptionist duties, and sometimes the vet techs would have to do it. But like, we would have to come in there and get payment, and I would hate to do that because I'm like, they are bringing their dog in to be euthanized, and here I go in with paperwork, having them sign it. I'm gonna need a credit card to pay for this. Like, I'm like, it was the hardest. I was like, hey, receptionist, can you go do that for me? Okay, you do it. But I hated it. I was like, this should not. Yeah, it's awful. And then I have a story. Back in Illinois, I was working with, it was Animal Hospital in Streamwood. And if you know where Streamwood is, on 59 in Irving Park, it's called Animal Hospital in Streamwood in Illinois. That's where I work, on Barrington Road. And then it was that hospital. It was a Maltese, and I guess they were neighbors, and the German Shepherd and the Maltese, there was a gate, and I guess they kind of met up or whatever, or the Maltese was by the gate and the German Shepherd. Anyways, the German Shepherd went towards that Maltese, pulled that Maltese through the gate. You talk about Oh, that poor animal, dude. You talk about, oh my God. I will always remember that for the rest of my life. We had to put it down, but we gave that dog like so much pain meds. We're like, we called the owner and said, you need to get here right now. Your dog needs to be euthanized. The vet was like, we can't, like, this dog is like literally crying in pain. You could see the bone. It was the most, oh man. Anyway, ugh. And then I had to call animal control, same hospital. The dog came in and I wanted to like beat this guy because I'm like, you are so abusive. Ribs are totally visible. Doesn't eat. And I go in there to get like a chief complaint. Like, hi, what we here, how much, do you feed, the measurements. Oh, I feed 3 cups twice a day. And I said to myself, you're a fucking liar. I didn't say that out loud, but I said this dog is literally abused. Like skinny. So I told the vet, I said, you're gonna want to come look at this. I said, this is not okay. I was so mad I was like, and I told the veterinarian, I said, this is abuse. I said, I don't like this. I said, we need to call animal control. And the veterinarian goes, I agree. So he did his exam and they called animal control and yep. Bye-bye. It was bad. It was bad. Sorry. You have some weird stories. I would tell Aaron all about like Lexane patellas. That was something I was assisting in surgery for knee replacements. So it's basically where the knee socket or the thing, whatever, it kind of pops in and out. And it's common in small breeds. So your Boston Terriers, your miniature poodles, Dachshunds, those kind of types of breeds. Also with, I'm giving you tips. So if you have a dog that's a Cocker Spaniel and those long floppy ears, they are common to get ear infections. So when you bathe your dog, always put cotton balls inside of the ears so you don't get water and soap into those ears. So that's something for you to always do because they're always common to get those ear infections. Those floppy. Do your ears hang low? Do they wobble to the floor? And then I did dental X-rays. Those were hard. We had a CVT come in. She's certified, and so she was teaching us how to do like the dental X-rays and how to angle it, and it was hard. It was, yeah. We had to study and we had to do that. It was pretty hard, but we got it. We had to like do it like multiple takes. But I did clean a lot of dogs' teeth. Yeah. Hi, my Cocker Spaniel. Wait, what dog would you say comes in with the most health issues I've heard in with their health? Pit bulls, so skin allergies. So a lot of like, yeah, I would say pit bulls, bulldogs. You have your labs with their ACL. They always have an ACL. Cocker Spaniels with those long ears, ear infections. But I would say pit bulls and bulldogs would be the number one with allergies and skin infections. I like doodles. So you ran the office, you handled every animal. I was not the vet, no. So what we did was it's different everywhere. So we have rooms. So the receptionist puts the patient into the room. Us as technicians has to go get, it's called a siglement, oh my God, siglement, whatever, where it's basically, the breed, the gender, the age, the history, the chief complaint. Why are you